A new multi-university report is recommending urgent policy changes to make sure New Zealand's future health workforce reflects the diverse communities it will serve. The report, a collaboration between Otago University, Auckland University and AUT, shows us the systemic underrepresentation of Māori and Pacific students enrolled in the first year of health programs. Professor Denise Wilson no Ngāti Tahi Ngā Tainui from Auckland University of Technology is a co-author of the paper, and she's with us now. Tēnā koe, Professor Wilson. Thank you for joining us. Nice to talk to you again.
Tēnā koe, Neil. Good to be here.
How are New Zealand's health workforce students not reflecting the communities they serve?
Population of Māori, which is around 16.5%. Our Māori health population, professional population, is much lower than that. So, for example, nursing, registered nurses, they make up 7.5% of the registered nursing workforce. And that's been that way for about 4 decades. It's hovered around that amount. So we've got a chronic underrepresentation.
And what policy changes then are you recommending to help address these issues?
I think there needs to be a commitment, first of all, by everybody that this is an issue. So we want to see a nationally coordinated system to collect and monitor the data of Māori and Pacific through health professional programs. We want agencies to look at how they fund and make funding decisions, and particularly around making funding decisions based on te tiriti.
And do you believe then that raising the number of Māori and Pacific students and students who come from perhaps lower socioeconomic and rural backgrounds is an achievable goal?
I think, as I've said, it's going to take considerable commitment. We know that this has been an issue for ever, but we also need to make some hard policy decisions around how we're going to support our Māori and Pacific, particularly from, who are socioeconomically disadvantaged and who live rurally. So, cost and access are significant issues for our people wanting to go into the health professions.
And we know that Māori and Pacific, if they're working in the health sector and dealing with Māori and Pacific, it does make a bit of a difference. So why is it important then to have health professionals from different backgrounds at the forefront of care, those facing the public?
Well, we know, access and quality of care are reflected in the poor outcomes that Māori have, and that we're more likely to die roughly around 7 years earlier than other New Zealanders, and that we have our whānau mistrust the health services that they need to seek. So seeing Māori health professionals is really quite warming for our whānau. They talk about, Māori health professionals knowing their realities, that they can feel more comfortable with them, and it goes a long way in terms of building up their trust in the health services they're seeking.
So when do you want something to happen, and how do you want this to happen to help perhaps change this outcome?
I've been advocating for shifts in this for a number of years. I think it's long overdue, and I think this is an urgent issue facing our health profession. Te Whata Ora and Te Aka Whai Ora have already said that they need to have an increase in the Māori health workforce, but it's going to take a concerted effort on education and health working together. So at the moment, that doesn't necessarily happen. So we've got education preparing our health workforce, and health being, using the graduates, but they don't necessarily talk to one another. So good workforce planning is needed.
Okay. Professor Denise Wilson from AUT, thank you so much for your time today. Ngā mihi.
Ngā mihi.